As this generation, 55 to 64, moves into the retirement window within the next 10 to 15 years, they're going to experience levels of morbidity, disability, and frailty that are higher than the generations that you now see in retirement between 65 and 74.
Good evening, everyone. My name is Bob Gallucci. I'm the president of the MacArthur Foundation. I'm glad to welcome you here this evening as our distinguished panelists discuss an issue that has profound implications for our future. America is aging. Powerful demographic trends coupled with advances in science and medicine make it likely that by 2050 we will see more walkers than strollers around us. The consequences for our society and its core institutions are profound, and we must understand and face them now. In response to the challenges and opportunities of this trend, the MacArthur Foundation formed the MacArthur Research Network on an Aging Society, and formed this network in 2008. This evening, we will hear from members of that network of its early findings and their significance for our country. The MacArthur Foundation has a long history of addressing complex social problems. Though we are best known for our Fellows Program, the so-called Genius Grants, that is actually a small, if important, part of our mission. We make grants of $230 million every year in the United States and across the world. But no place is more important to us than Chicago. It is our headquarters and our home. Over the past 30 years, MacArthur has invested nearly $800 million in Chicago. Our grants have supported about 1,000 organizations and individuals. We have committed more than $200 million to support community and economic development in 16 low-income neighborhoods, including a foreclosure prevention and mitigation project to help families stay in their homes and to put foreclosed houses back into productive use. We award more than $7 million each year to more than 200 arts and culture groups in the Chicago region, including theaters, dance groups, music organizations, visual art programs, film centers, museums, and libraries. One of MacArthur's signature modes of grant-making has been the Interdisciplinary Research Network. We have funded 35 of these since 1979. These networks function by bringing together scholars and practitioners with a wide range of expertise and insights to tackle a complex question over several years. Many of those questions have been about how we structure the course of our lives, what we do in infancy, childhood, youth, phases of maturity, and old age. For example, MacArthur networks have studied early experience in brain development, successful pathways through middle childhood, which highlighted the importance of early education, transitions to adulthood, which looked at the lengthening period after the teenage years, successful midlife development, which produced a major longitudinal survey taken up by the federal government, and successful aging. The last of these, the new research network on successful aging, helped spark significant changes on how Americans conceived of the aging process. The network's research showed how, in old age, behavior became at least as important as genetics, and how healthy lifestyles, exercise, and engagement improved mental and physical performance. Rather than seeing the latter years as a period of decline and dependency, the network drew attention to the potential that people have to make a positive contribution well after their 60s or 70s. That network was led by Dr. Jack Rowe. Its signal success prompted us to turn to him again as we considered how changes in life expectancy would affect our society and its institutions. The Network on the Aging Society began its work in 2008 with Jack as chair. Last December, a network study released some startling findings. We were aware that life expectancy had increased. Over the past century, the U.S. average lifespan has climbed from 47 to 77 years with no sign of stopping. And something unprecedented may be ahead, an increase in the maximum possible lifespan that could make a century of life a regular rather than an exceptional phenomenon. A key early finding of the Network on the Aging Society was that official government projections for longevity are probably too low. Americans may live 3.1 to 7.9 years longer than policymakers have expected, and that has considerable consequences. The fabric of American society, our cities, houses, workplaces, retirement plans, and medical system were designed for a different age structure, with many more young people than old. A society with an inverted age pyramid will create a heavier burden for younger people and could lead to intergenerational tensions. The disparities and inequalities that exist could be exacerbated as minority populations, younger and poorer, see their prospects reduced. And there are serious implications for America's fiscal health, as spending on entitlements such as Social Security and Medicare take up an ever-growing share of the federal budget. To present the network's important work, we have our chair, Dr. Jack Rowe, who is professor in the Department of Health Policy and Management at the Columbia University Mailman School of Public Health. He is also a former chairman and CEO of Aetna and a past president of Mount Sinai Hospital and School of Medicine. Jack will speak briefly about the myths and realities in what we know about aging. He is joined by Dr. J. Olshansky, professor in the School of Public Health at the University of Illinois here in Chicago, and a research associate at the London School of Hygiene and Tropical Medicine. Their discussion, and then your questions, will be moderated by Judy Graham, a health reporter at the Chicago Tribune. Ladies and gentlemen, we look forward to a very interesting, informative, and maybe even exciting evening. And I now thank you for coming and turn it over to you, Judy.
A little bit more about the format before I start my questioning. I'll address, is there a way of dealing with this echo? Jay and Jack, and then we'll speak together for about 35, 40 minutes, and then I'll open the floor for questioning from all of you. So, Jay, let's start with the demographic trends that lie ahead. What can you tell us in our future?
Actually, what I'm going to do is I'm going to take a couple of minutes and explain some of the basic demographics, some of the radical changes in the population that we are about to see. I'm just going to use a couple of figures to illustrate this point, but it should prompt plenty of questions, I would imagine, in the future. Let's show the first slide. So here we have a population like the United States, and what you can see in the younger ages, down at the bottom is age 0, down at the top is age 100, is you can essentially see a century's worth of population change. Now what you see right in the middle, that big bulge, is what everyone knows as the baby boom generation born between 1946 and 1964. Right after that were the baby busters, born between 1966 and 1974. And then the little bulge you see after that is what is an echo. It's essentially the children of the baby boom generation. So every 20 to 25 years, we are going to see an echo of that baby boom generation born between 46 and 64. This is currently called an age pyramid. It is about to go through a radical transformation, and it will be a permanent transformation in the United States and every other country on the planet. Let's take a look at the next slide. All right, so here's a picture, an age pyramid of the United States in the year 2000. On the right side is women, on the left side is men. So you could see it's in the typical pyramidal form, and right in the middle is that post-World War II baby boom generation. The next slide, so this is a demographer's trick, and I know Judy had asked me about this. Why is this on its side? Well, it's an old demographer's trick. You turn it on its side, and you actually get to see the human wave, the population of humanity, about to reach retirement ages. So I drew an orange line there to illustrate that it actually is going to happen 9 months from now. January 1st of 2011 is when it begins, and you will see a permanent change in the age structure of the United States and a permanent change in the age structure of every other developed country across the globe.
Can I interrupt you for a second? When you say January 1st, 2011 is when it begins, what begins then?
It's when a very large generation, the first generation of the baby boomers, born in 1964, that's when they begin to reach retirement ages.
Okay.
Ages 65 and over. And so for the 20 years after that, that huge wave, those baby boomers are going to be moving in to retirement ages. Jack is giving me a timeout.
Born in 1946.
46?
Not 64.
I'm sorry, born from 1946 to 64. So roughly that 20 years. Sorry. And then the next picture.
Nice to make a contribution.
Yeah. That's fine. And this is what the United States is going to look like in the year 2050. So we will no longer be pyramidal. We will be square-like. And if you notice way up at the top, the population of women is going to dramatically exceed the population of men aged 85 and over. We are going to see this transformation across the globe. So you can imagine, globally, when a population shifts, experiences a radical transformation in its age structure like this, it has profound economic and social implications. I think I may have two more. All right, so so one of the things that we did, and this is what Bob was talking about earlier, the forecasts that we had just published in December indicated that the Social Security Administration and the Census Bureau, we think, have underestimated life expectancy by anywhere from 3 to 7 years. Now, it may not seem like much going out to 2050, but every single year difference in life expectancy projected out to 2050 produces a huge difference in the number of people who live into retirement ages 65 and over between now and 2050. It is dramatic.
And what are the implications for costs?
Well, I'll show you that in a moment. I think, is there one more? Yeah, this is the last slide I'm going to show. So these are the main conclusions that we came to in this manuscript. The first one is life expectancy is underestimated by about 3.1 to 4.5 years. So a person year of life, of course, is an individual who lives 1 year of life. If one person lives 10 years, that's 10 person years of life. We are anticipating there will be anywhere from 164 to 239 million extra person years of life lived between now and 2050 relative to what's projected by the Census Bureau and Social Security Administration. Outlays for Medicare and Social Security, just as one example, we think are underestimated by anywhere between $3.2 to $4.7 trillion between now and 2050. Next. And this is the last one. These gains in life expectancy that we anticipate could be attenuated by existing health disparities. And that actually, I know, is going to come up during the course of the discussion. It is a product, one of the next products of our work, and I know it's a product of other work that's going on at the MacArthur Foundation as well. But this has the potential to have a profound influence on the future of longevity for every segment of the U.S. population. And I think I'll just end there. I just wanted to give you a basic, alarm bell, letting you know that it's about to happen beginning in 9 months. So.
All right, Jack, what can you tell us about the implications for policy and what needs to happen and why?
Well, let me start on behalf of Jay and the other members of our network, including Professor Cacioppo from the University of Chicago, who's watching us carefully here, to thank the foundation and particularly thank Mike Stegman and Julie Stash and staff that have been primarily responsible for overseeing our efforts. They not only provide financial support, but terrific encouragement, advice, and actually lots of very good ideas. So it makes for a very good partnership. I've bounced around a lot of foundations over my career, and this is really exceptional in terms of the interactions. The implications are quite easy to think of at some level, and that is that the basic infrastructure of our society, the institutions of our society, whether it's education, the family, the workforce, retirement, communities and their structure, volunteerism, these core institutions of our society, they were built to support a society with a fundamentally different age distribution than the society that we're going to have. And they are not going to function effectively unless they are modified significantly. And the importance of this work that Jay has outlined for you is that the changes are going to be greater than we thought and occur in an accelerated pathway. One of the interesting accelerations here, Europe has aged before us, Japan has aged before us, and maybe we should just look over the fence and see what we can learn there. And we'll maybe touch on some of those international comparisons and their limitations. But what's happening in the U.S. is the reason those countries aged ahead of us was that we had this big baby boom group that was diluting the elderly and keeping our average age down. As that baby boom group moves through age 65, as Jay showed, we're going to have an accelerated conversion to an aging society compared to these other societies. So we're going to have to build a capacity to re-engineer the core institutions of our society rather promptly.
Give me an example of what you're talking about and go into it in a little bit more depth. Let's talk about the family, for instance.
Families are interesting. One of our network members, Laura Carstensen, is a distinguished psychologist at Stanford, described it in one sentence. Families used to be vertical and biological. Now they're horizontal and voluntary. We are going to have the possibility of 5 and maybe 6 generation families. That's a different family.
But all living in different places, perhaps.
Well, that's the question. Where should they live? Where will they live? How will they connect with each other? What's going to happen to transfers? Right now, a lot of people tend to look at the elderly as greedy geezers, but the data support the view that the elderly are, in fact, net givers to the younger generations up until their early 80s. Are those intergenerational transfers going to change as people live even longer and longer, and their consumption relies more and more on the resources that they have? And if they're not giving to their grandchildren, who's going to pay for the education of those grandchildren? So there are intergenerational, familial issues that are substantive.
Then how does that translate into the policy arena? How do you begin to create policy around those sets of issues?
All right, here's an example. I'll give you one ad hoc example. We've been talking about how to keep people in the workforce longer, because that'll solve a lot of problems. Keeps them engaged, it's good for them, they're productive, they're not using retirement funds, pensions, et cetera, which are often currently underfunded. They may not be getting Social Security benefits yet, et cetera. It solves a lot of problems. Well, how do you keep people involved longer? So here's an idea. Now, this is an idea we made up a couple of days ago. I'm not sure it's got wings, but we were thinking, well, let's get people to start having a more flexible work late in life, because they hate their job and they can't wait to retire. So we're going to give them, a half a day a week, and we're going to let them go volunteer in the schools, in the community, or in the hospitals in the community, or do something else even in the work. And, but they're going to get paid for that. And the employer's benefit is that if people get more engaged in work and they transition to more volunteerism and things are more flexible, that they may keep working another year or two, which would be a huge benefit. Well, how do you arrange that? How do you get the incentive right? So here was the idea I came up with, and that is, instead of giving them a check, the money they get for that half day a week, okay, goes into one of these 529 accounts for their grandchildren. So there's an additional incentive for them to do it. And it might even help mitigate this risk that the grandchildren aren't going to get as much. I'm making this up. You didn't tell me you were going to ask me to say that. And as my daughter told me yesterday, that I should write the answers on my palm, because that's evidently currently very popular. So there's an idea. So the idea is, what kind of financial incentives can we put in to change the life course? And we'll talk maybe a little later in more detail about this. The distribution of work and leisure and volunteerism and education to make it functional for this new society.
It's interesting because just before I came here, one of my older colleagues in the newsroom came up to me and said, I would like to continue working as long as I possibly can, but I'm afraid of the ageism in the workplace might not make that possible. So it seems to me there's a fundamental issue regarding attitudes toward the elderly that is at risk here.
It's true at every level, because at the lower level of income, people can't wait to get out of their work in many cases, and they in addition have an economic incentive to do it, because the Social Security benefits that they're going to get after retirement represent a much higher proportion of the income that they were getting for working full time than the proportion that it would represent for us. And so that's the group that we need to particularly focus on providing some economic incentive for to stay in the workforce, and maybe some flexibility. And for other groups higher along the SES pathway, we need to make sure that the culture of the workforce is such that they feel that they're a productive part of the workforce.
Jay, I'm going to throw a question your way because you've been just watching us. Have at it. Was there any response to the projections in the article from the government when you said that they may have underestimated the life expectancy and the costs?
Well, the chief actuary of the Social Security Administration is a personal friend of mine, but he's also an advisor to our group. So he knew about our conclusions before we had published them. And he's in a bit of a precarious position. He is not political. He is a scientist, and he sticks to the science. But I will tell you that there are pressures in the world of science to encourage the Social Security Administration at one level, and so I guess now I'm on both sides, at one level to raise their forecasts of life expectancy in anticipation of major advances that are going to occur in the biomedical sciences that allow people to live longer. But on the other hand, there are other people encouraging the Social Security Administration and the Census Bureau to lower their forecasts in anticipation of some subgroups of the population that might experience a decline in life expectancy. Now, I've actually advised the Social Security Administration now in both directions, quite frankly. But our conclusion, I think, is fairly straightforward, and that is we think they're both going to happen simultaneously.
Can you tell us more about the biomedical advances and what might be on the horizon that you tried to factor into these projections?
Well, in the forecasts, we came up with two basic ways in which we think life expectancy is going to rise in the future. One is what everyone knows as the disease-specific model. In other words, we will continue to be more successful at combating heart disease, cancer, stroke, lowering case fatality rates, enabling people to survive longer after they have the disease. I don't anticipate there will be cures necessarily, but there will be reductions in the risk of these diseases over time, over the next few decades. But we also wanted to model the future in a different way. We also think that there are going to be some interventions that slow the biological process of aging, and that these interventions are going to come online within the next couple of decades, and that people in this room are going to be taking interventions that slow our biological process of aging. So we modeled that in this particular manuscript and demonstrate what would happen if we succeed in slowing the biological process of aging. So the details are contained in the paper.
Yeah, I would emphasize also that we know these folks, particularly Social Security, rather well as professional colleagues, and I'm absolutely confident that they're playing this right down the middle of their fairway, that this is not a politically motivated set of data or projections. They just are more conservative than we are with respect to what's going to happen with biomedical advances or, in fact, maybe even changing the issues of aging itself. And we're not sure we're right. But if we're half right, there's a problem. And so I think it's not that we're trashing them. It's what we're trying to say is that if we're planning for the future of our society and we have different projections on the table, we don't really know what's going to happen. These projections that we've developed, that Jay and his colleagues have developed, seem like they should be on the table as we think about the policies that we need to put in place.
Actually, what's important to realize is that even if life expectancy does not rise any higher than what the Social Security Administration is currently projecting, everything I told you about the aging of the population is going to happen anyway. It is an inevitable demographic transformation we are about to experience.
Is it going to happen evenly across the population, or will some groups benefit and see longer life expectancy while others suffer and don't realize the same gains?
All right, so you're anticipating our next manuscript.
Yeah, I didn't give it to her.
All right, let me answer this delicately without providing too much information about the next manuscript. Look, we know there are disparities that exist in the United States today. Everybody knows that these disparities exist. They are fairly dramatic. In this next work that we are doing, we are going to outline in somewhat excruciating detail how they play out by education within the United States and by region within the United States. And let me just put it this way.
And by race.
And by, that's right, by race and by sex. Let me put it this way. If we experience anything remotely resembling what the Social Security Administration is anticipating or what we are anticipating, someone's going to get left behind. I'll leave it at that. It's going to be rather dramatic.
Now, Jack, help me understand what the failure to act to address this issue might look like. Paint a picture of where we might be 20 years from now.
Well, if we don't put the right policies in place and get the core institutions reoriented, and you notice that we're just not talking about Social Security and Medicare, it's all these other things. The question is, what will life be like in an aging America? Really not how much am I going to get in my Medicare or Social Security check. Those are important things, but we're talking about what is life going to be like. If we don't fix it or we don't get it right, it's going to be pretty ugly. There'll be three aspects of it. The first relates to what Jay is alluding to, and that is that the current gaps between the haves and the have-nots with respect to opportunity, access to education, well-being, those gaps will be much greater. There will be two Americas.
Is this across the age spans that you're speaking of, or within the group of elderly Americans?
No, it's not just the elderly. It's the other generations as well. One of the key points here, and I'm glad you brought this up, is that this is not just about the elderly. That's a mistake. We have to think about this in terms of all the generations. We have to fix the society. It's not the elderly problem. It's the relative proportions. Okay? And the problem with this number one aspect of what would be ugly about the haves and the have-nots is that there will be significant racial differences in different generations, that the younger generations coming up are going to be much more proportionately Hispanic. Proportion of Hispanics will double in the next 30 years. And there'll be a Hispanic, Black, Asian majority of the young population. The question is not, will middle-aged and young people support old people? They always have. The question is, will a young Latino population support an old white population? That's an added dimension to the issue. So that's number one. The second is that if we don't fix it, we're going to have a society which is not going to have the capability to produce the goods and services that are going to be used by this larger, elderly, fit, active population. And the third, and in many ways the most disappointing, would be that we will have created a society which will not extract the benefits of the wisdom and the experience and the capabilities of this growing, fit, older population. That, you know, old age in America is a role-less role. And if we don't change that, we're really throwing our future away. And so those are the three principal aspects of what I think failure would look like.
So let's flip the question, and I open it to both or either one of you. What might success look like?
Be fabulous. Fabulous. You're going to love it. You're just going to love it. Well, let me pick on one or two tiny examples or slices. We currently live in age-segregated communities. And the people that I deal with are my age, and the people that you deal with are your age. And the communities we live in are not built to support an aging population or a different population of different groups. So imagine that we would build a community where we had the schools next to the assisted living facilities. There's an idea. If we think volunteerism is a good idea, I never saw a school next to an assisted living facility. Now, there may be one somewhere, and I'd love to see it. But we think about a society, think about a community that is not age segregated by design. It's an idea. And And think about a workforce which does not have a cliff at age 65, and so on. So I think that one can imagine, and just like in this great, wonderful country of ours, this huge country with 300 million people, and every natural experiment you can imagine, there are communities where things like this are happening.
I just saw a study from the Rand Corporation and the University of Michigan about growing rates of disabilities in the 50 to 64-year-old population. Can you talk about that and some of the question marks about the generation just behind the 60, the current elderly?
All right, so this is a really good question, and I would imagine a lot of people are not aware of this, but you remember that pyramid that I showed you earlier, and you've got the baby boomers and the busters, and so each of these generations carries with them throughout the age structure different mortality risks, different frailty risks, different disability risks. And what researchers have discovered, and this is a paper that had just come out, is that the generation that is
From
now...
a member of our network.
That's right, Dana Goldman. Formerly from Rand. That the generation just now approaching retirement, between 55 and 64 in the United States, has significantly higher levels of frailty, morbidity, and disability than the generation that just preceded them. So what we can anticipate, believe it or not, right, I'm sure a lot of people are unaware of that. What we anticipate is that as this generation, 55 to 64, moves into the retirement window within the next 10 to 15 years, they are going to experience levels of morbidity, disability, and frailty that are higher than the generations that you now see in retirement between 65 and 74. Now, we also have an entire generation of children who we know, and many of us have worked in this area, are obese or overweight. And these individuals will carry their risks with them into middle age, and then when they get older, into older ages. And so you see variation as a function of birth cohort happening within the United States. And there's also evidence to suggest, by the way, and I've written on this topic, the title of the paper I wrote was The Canary in the Coal Mine of Coronary Artery Disease, suggesting that we may be on the verge of a rise in coronary artery disease, in part because of obesity and diabetes that have proliferated. And I'd point out, by the way, that the Social Security, one of the things the Social Security Administration did in their projections recently was anticipate a dramatic reduction in deaths associated with diabetes, completely inconsistent with the evidence that suggests it's going to go in the exact opposite direction.
So in addition to the haves and have-nots of aging in terms of income and education, you're going to have the haves and have-not in terms of health status. Mm-hmm. You're going to have the healthy, active elderly that you've been referring to, Jack, and then this other population that will have a burden of disability and chronic illness, and their experiences are going to be very different.
Jack?
And the predictors of that disability are less age than they are education. So at age 60, if you have less than a high school education, or less than a grammar school education, the likelihood that you're going to be physically fit is about 25%. At age 60, if you have more than a college or more education, the likelihood that you're going to be physically fit is about 60%. So, I mean, there's just, and education is in some way a proxy for socioeconomic status and a lot of other things that are going on there, but it's quite clear that it's not about age only, but it's about these other aspects of the experience as you march through our society.
So these men gave me a task of coming up with a question they hadn't faced before. And I will take advantage of the recent events to ask, how will health reform influence the outlook that you've sketched here now that we actually have a healthcare overhaul in the United States?
Well, Jack,
I'm
have you
so
heard that
sorry.
one before?
I've heard that.
Sorry.
To whatever extent we've been saying that the gap between the haves and the have-nots with respect to opportunity, education, and wellness tears at the fabric of our society and reduces the likelihood that we will have a productive and equitable society, then anything that moves to include larger numbers of individuals in the group that has access to health care is a very, very good thing, period.
All right, enough of me. Now I open it to questions from the audience. We have 3 mics, and why don't you raise your hands and hopefully I can see you. Back there.
I speak as a baby boomer who will turn 65 at the end of 2011 and anxiously looking forward to qualifying for Medicare. But my question to Dr. Rowe is, you talk about keeping people in the workforce longer. I know I'm also in the cohort, extremely well educated, who was pushed out of the workforce years before I had planned to be pushed out. And we are starting a new trend where those of us born in 1946 are claiming Social Security at a much higher rate than had been anticipated because people do not want people our age in the workforce.
Well, a couple points here, and obviously your experience is not unique. The age at which people were drawing Social Security benefits progressively fell for many years. But about 3 years ago, it leveled off, and in the last 2 years, it's actually increased 1.5 years, which is a dramatic increase. And so people are now starting to stay in the workforce longer. Maybe employers' attitudes are changing finally. One of the things that may be working are research findings, in part from a fellow named Axel Borst-Suppan, who's an economist who's a member of our network, who was in Germany, who evaluated the question of, do you have to kick the older workers out of the workforce in order to make room for the younger workers? That may have been what in part was going on in your place of employment, that there was an epidemic of that. And it's now been shown throughout Western Europe and also by David Wise of Harvard University here in the United States, that that's not the case, that in fact higher older age employment is associated with higher younger age employment, that it's basically the rising tide lifts all the ships, so what you need is more productivity, but there's not a replacement effect. And as that becomes more and more obvious to employers, you're going to see less of what you experienced. But what we need is, I think, as Bob Gallucci mentioned in the interviews, I had a period of time where I worked in the private sector as an employer, and I think that the employers could use some incentives to get them over the mythology that they have about older workers and give them the experience of having more older workers for longer periods of time, which would be very beneficial. We just have to get them to take the medicine for a while. So we need some incentives there. Thank you.
The experience in a couple of my in-laws, and it's the government problem. They were both teachers in their 50s. Because of the school board, it was cheaper to dump them out and take a younger teacher, a math teacher and a chemistry teacher, because the state had to pay for it. Now, maybe Illinois has finally adjusted that, but it was a massively bad public policy. And, of course, what that brings to light is institutions, which can be large employers, but more and more, it's government, which seems to be a rising tide in terms of employment, that for union reasons or the government themselves have these kind of social policies that are really counterproductive. I mean, in that case, with some people in their 50s, a math teacher and a science teacher, they lost probably between the two of them, which they're having a great time in retirement at their high retirement benefits, which tend to be higher in government. They lost maybe 20 years of really first-class high skill. And it's directly governmental policies, and there's a major problem that they aren't in any way pushed by economic forces like businesses have to be who compete. And isn't that a central part of this problem in the future of getting adjustments to these well-entrenched and non-competitive situations that government is more and more having more and more employment?
You know, I think you're absolutely right. One of the, we see ourselves in our group, I think, and I think the foundation aspires to have us perform like this. We see ourselves developing information that can inform policy, and at the same time we see ourselves trying to foster the discussion that will lead to the changes in these archaic policies. For instance, maybe we'll get a couple hundred important people together in Chicago, and we'll talk about it. And you know, well, hopefully some of these ideas will stick and have an effect. And
Or
but
maybe,
you're absolutely right.
Maybe you start trying to convince government to set a model that private industry can follow thereafter.
The unions, you mentioned unions, and I've been speaking with someone who runs a large county government about doing an experiment, having our network do an experiment in his county. And I asked him about his thoughts about whether the union would be against this. This was an idea of extending retirement, having people volunteer half a day a week, and so on. He said he thought the unions would be for it. He says, you know, the active members of the union pay dues, and they want to keep as many people in the workforce as possible. When people drop out these days, people are not hired to replace them in many cases because of the tight government budgets and decreasing tax revenues, et cetera. So he actually thought that there may be some incentives there.
I'm sure there are more questions. Would you like to take a shot at it?
Thank you. This is very interesting, and I'm very glad that you're taking a holistic approach at looking at the problems. And one of the questions that came to my mind as we look at this is there's an issue of communication and community that are the major issues. The culture of America has changed, so we don't have community to support the aging process, and we don't have the folks that think about their backgrounds of being immigrants and the like, where elderly people were taken care of and you had generational support. Your concept of horizontal families and voluntary families, I think, is really critical. I wonder, in your study, what your findings were on, one, the issue of singles, and then two, if you could talk about the role of including religious groups and entities in weaving the network of family and support and education and communication of this issue.
And I'll add something to that, and maybe, Jay, you can take a shot at it. All of those single women at the top, right, those older women who presumably may not, you know, have men in their households.
But let me comment on just one thing about churches and give you a second to think of a response on the rest of it. This is, you know, we haven't spent a lot of time on some of these issues yet. There's a long list of topics we'd like to work on. The churches are changing in America. And it turns out that mega churches are being built largely for elderly. It turns out that at any one time there are between 200 and 300 empty Walmart stores in the United States. The big box stores, they're called ghost boxes. And there are a couple architectural firms in the Midwest that specialize in converting empty Walmarts to mega churches. We just had a conference on housing and communities in the elderly in part of our network's activities, and this was one of the presentations that was given. It's amazing, but it fits in with how are the communities changing and how are the churches changing. It's a remarkable new kind of development. But
yeah, I mean, something you said really caught my attention. When you were referring to singles, And I know you were looking at the top of that age pyramid, and you saw the women way out, a lot of 85-year-old women, many fewer 85-year-old men. And you're right. Right now, many of them are single. Many of the women are single. Their husbands have died. Obviously, women, live, I think it's about 5 to 6 years longer than men. So it occurred to me when you said that, one of the transformations we're going to experience is you're going to see that move up to higher and higher ages. So men are going to live longer along with women into those retirement years. They're going to be spending more years married. Let me put it that way. What you see today in our world of aging is not the same world you are going to see in the coming decades. The people who are at the top of that age pyramid are the ones that were born at the beginning of the 20th century. They faced an enormous set of pressures during the course of the 20th century that essentially pared them down to a relatively small, highly selected subgroup of individuals that have unique characteristics. Many of them are extraordinarily healthy and vibrant and want to continue to work. But what you're going to see in the future is not what you see now. There are going to be many, many more extraordinarily healthy, vibrant people who make it out into retirement ages past 65, past 85, even past 100, on the one hand. And on the other hand, you're going to see the other end of that coin as well. Many, many more people who are frail and disabled because medical technology is enabling those people to live longer and experience aging for a longer time period. So I guess what caught my attention was the number of singles, and I wouldn't draw any conclusions about the future based on what you see in terms of age pyramids today.
I know there's a lady here, and then you will be next after we've been biased toward the front of the room, and I promise you'll be next.
Well, I can appreciate the policy creation, but I'm a student of my university down south with an MBA, and I look at the economics in a business which drives everything. And in reference to the woman who spoke before, there's this image, there's this term called the gatekeeper, who has become a very core gatekeeper for hiring. And the stereotype, and it may be anecdotal, and it's certainly not the research you provide, but it is the 30-year-old gatekeeper that is uncomfortable hiring somebody that's as old as mom or dad, or as a friend said, or older. And if our life expectancy is pushing to 80, 90, 100, 110, with better memories than we have now, what is going to cause that shift? And Dr. Rowe, my question is, I don't think the presidents of companies know. These gatekeepers are turning away the years of experience, the paradigm shifts, the up and down of the problems that are going to save their companies. And I think the U.S. could be poised to have the collapse of a lot of organizations, both profit and nonprofit.
Well, I am sure you're right about the experience and the gatekeeper effect. What I would say, based on my experience as chairman and CEO of a $30 billion company for 6 years, is the gatekeeper will do what he or she is told. And we need to get the leadership of these corporations to understand. We don't need to educate the gatekeepers. We need to get the leadership, the boards and the CEOs and so on of these companies. And these CEOs are not as stupid as you think. They are capable of getting it. And so are the boards. And if we can get our messages lined up and we can get them communicated effectively, and all you need is we don't need to get the CEO of every Fortune 100 company. We need a couple people who will change the culture of their company. And there are examples in Europe already of workforce culture that could be adopted. And if it works and it winds up being in the shareholders' best interest, that gatekeeper will get the message. So the target's not the gatekeeper, but there is a target.
Okay, back there.
Yes, like my cohort sister behind me, I'm 63 years old. I was forced into what we politely call retirement. I'm just out of work, basically, and exiled out of the country. I live in the Philippines now. I'm only here visiting my family, my 85-year-old mother, who depends on my sister to take care of her. So I've got a kind of question that's a little to left field. I live in the Philippines because I can afford to live there. I can maintain some modicum of middle-class dignity. And as the wheels start to come off, I can depend on this nurturing culture to take care of me and not leave me drooling in the corner in some minimum security prison they call a nursing home at a price I can afford. Do you see in your figures or your research a burgeoning of this outsourcing of the elderly to the developing world, of which I and a lot of other expats are a part?
Yeah.
Thank you.
Yeah, I mean, that's a brilliant question. And honestly, I have not given thought to the movement of an older population elsewhere, but I think you're absolutely right. I think it's possible, perhaps likely, that we might see a migration of older individuals to places to retire that are much more economically friendly. We may want to look into that. But
The only thing, gee, I think it's a really interesting question. There was a prize for a question you'd never been asked before?
you know, actually, that would qualify.
Give them a lamp or something.
No, we've come up to us afterwards. We have something for you.
We have something for you. But there is an immigration of the elderly that has occurred, and I'll tell you what it is very quickly, and that is in France. They had a tremendous number of people from northern Africa, largely Algeria, come in, as you know, and working, and men and women, and then they met each other and they had babies, and now they've had influx of immigrants, of grandparents of these little children coming in from Algeria to take care of the kids while the young parents are working. And all those people, the minute they get off the boat or the plane from Algeria into France, are eligible for all the entitlements in France. And so that's been a kind of grandparent immigration, which has been an issue for the French.
I will tell you that I had a friend when I lived in New York City who was a Russian immigrant. She was a dissident, and she became elderly. Her husband died, and when Russia opened up, she moved back to Moscow because her Social Security check from the United States would go a whole lot farther in Moscow than it would in New York City.
It's really interesting.
So another question. How about back there, there's a gentleman with his hand raised.
This migration has been going on for probably 25 years. I've heard of all my friends moved to Mexico, they moved to Asia. So I'm a little surprised that people are not aware of it. The only thing that people are concerned about when they get older is healthcare. So now they even have this insurance where they can airlift you back into the U.S. But now with the health vacations, they can go to other countries and get pretty good service. But
Sure.
I have a different question altogether, and it might be a little offensive. I don't mean to be that way. But let's say we had a policy where in the U.S. there was, for CEOs, for example, some companies say that you must retire at 60 or 62 or 65. What if we had something like that for the general management, general workers in the U.S., where you would essentially have to retire at 60 or 65? You could be kept on. But afterwards, you could elect to stay on, be productive. However, your rates would be lowered by half.
Yeah.
This is just an idea,
Sure.
because people look in the HR departments
Right.
where they say, this is a gatekeeper.
Yeah.
They look at a so-called age-wage profile.
Right.
So when you come in as an entry-level person, you get paid lower than your worth. And eventually, with yearly increases, you are worth, or you're getting paid more than you're actually worth.
Right.
So if we could adjust that and not have government subsidies, but actually make it a deal for companies, I think it would be worthwhile if people elect to stay in the workforce.
Well, let me comment on give you two actual examples that may be germane to this. This is a good question, and it's been discussed. One, it used to be that way in academia. You had to retire at age 65, and about 20 years ago or so, that was judged to be illegal, so that professors can continue. Because what they were doing is basically firing their professors and then hiring them as adjuncts at a much lower rate to teach the course or two that they used to teach, et cetera. And there are still some universities that do that, and the people are basically double dipping because they're getting their pension plus some sort of part-time. The other problem has been with the airlines. If you think about the airlines, they've got like 3 different levels of flight attendants. The ones who have been there a long time have really good benefits and a high salary, and then there's the other one, and then there's the third one that are getting very low salaries and hardly any benefits. And the airline's incentive is to fire or get rid of these older, not because they're older, they're very experienced and very professional, but they cost twice as much as the average. And many of the flight attendants might say, well, I want to keep working, and I understand the issue, and rather than have no job at all, why don't you fire me today and hire me tomorrow under the new plan? And so there are industries in which there have been these progressive strata that have developed, you know, and in the company I worked at, your pension, we had 4 or 5 different pension plans. For the people hired between this date and that date, they had this plan. The next people had X plan. The next people had Y plan. And we were thinking, how can we migrate some people from one plan to another, which will permit us to keep them in the workforce, you know? I think that this is the kind of engineering that we need to start thinking about. And we need to think about what's fair, and I think we need, whatever we do, to make it optional. And that is not mandatory. You're not going to get a mandatory rule that everybody has to be retired at age 50. It's just not going to make it through the court. I'm not a lawyer, but I'm led to believe it wouldn't make it through the courts. But if we can develop these flexible, optional ideas, you want to volunteer half day a week, you want to step out of your regular job and come back half time, you know, whatever, maybe we can start to make progress.
More questions?
I think both speakers, both of you give a marvelous and challenging perspective on what we're facing in the future in terms of aging policy and what the demographic picture pretends. But my question is to both of you is that given the opprobrium that Obama and the Democrats faced this past summer and fall with the passage of the Health Care Reform Act, and the very difficult challenges that this country has to make about increasing taxes to support Social Security, Medicare, other entitlement programs, what possible optimism can anybody in this audience, who I presume are mostly on the liberal side of the equation, otherwise they probably wouldn't be here, can feel that we have a Congress that's going to make really difficult decisions about the future of these entitlement programs, given the opposition that we see from particularly the Republican side of the equation?
I wasn't in the room when the conversation took place about establishing this network of activities at the board level, at the foundation. But my guess is that the conversation may have started with the statement you just made, and that is, what can the foundation do to try to get Congress to act, to try to break the logjam, to try to overcome the political risk aversiveness and the delays? How can the foundation, not as a lobbying group, but as somebody that supports research and policy work, throw some wood on the fire, if you will, to try to stimulate the discussion and bring the information to people's attention? And that's one of our goals. So I think that's what, I think, you know, Ms. Stash can speak more directly to this. She was there, and Mike, but I think that's one of the goals here. And we firmly believe that this is not political. We believe that this is evidence-based. Let's do the research. You've seen the numbers. Look, people, we can't wait. You know, we're trying to trying to make the case.
And actually, if I could emphasize just one point. I know that a lot of what we've talked about is in the way of challenges. I think what you will clearly see coming from this network is the way we see it is not just challenges but opportunities. Everything that you see, all of these transformations that are about to take place, we can take advantage of these transformations. And I think that's really, in part, what we're focused on.
It was good to hear Jack say, in a positive way, health reform could have some very positive effects on what we're talking about. Well, immigration reform is next, hopefully, somewhere along the line. And one of the things you said, if I heard you correctly, was that as the older population grows larger in proportion to the younger population, we're going to need a workforce beyond what we have here in the U.S., possibly to take care of the needs of or the products of the older population. As we get into immigration reform, rather than just have an emotional debate, maybe hopefully a more rational debate, would your information be helpful to help our policymakers understand that, like in Europe, can our older population do it without a greater younger population? That's working.
Thank you. This is the immigration question. And we've done some work on this, and we've written some on this recently. There are two issues with respect to immigration. The first is, are we going to have an adequate workforce, as you pointed out? And the fact is, in the United States, since our total fertility rate, the number of children born to the average woman is hovering right around the full replacement rate of 2.1. And since we have a fairly steady 1 million or so a year of immigrants, although it went down a little bit last year with the recession, currently we expect that our workforce will be adequate. So unlike a lot of Western Europe or Japan, where they have a very low TFR and they're xenophobic and don't like immigrants, they're really in trouble. We expect that we're going to be able to have an adequate workforce, particularly if we can keep some of the elderly in it. We will have skill gaps. We won't have enough engineers, maybe nurses, et cetera, and we'll have to have some policies that will facilitate that. That's the first immigration question. The second immigration question is the kind of anti-Lou Dobbs question, and that is why don't we just get a lot more immigrants, and that'll fix this problem we have of having more older people and not enough younger people? We'll just bring in the younger people, and we'll get back to a pyramid. And there are two problems with that. One is that it's recently been discovered that immigrants age. so that once you bring them in, they actually move up the pyramid. And the second thing is that you would need not a one-time shot. You would need a steady stream. You, in fact, would have to increase the annual immigration in the United States by 1,000% if you wanted to try to keep the proportions of over 65 and under 65 stable. So it's just not going to happen. But that's a very important issue. It's one of the myths that people have, that maybe let's turn to immigration. We're going to do immigration reform. We're going to open the black box of immigration reform. What can we put in there that's going to help this problem? That's a really important question, but that's the way we see it at this point.
At this point, we have about 5 minutes left before the reception. I didn't mean to cut you off, Jay, and then there's a man back there.
Well, actually, I just wanted to tell a brief 1-minute story on this immigration question because it's an important one. A couple of years ago, I was at a meeting of a group of economists, all young, and that's important. They were all in their early 30s in Italy. And they were facing the problem of a fertility rate, a birth rate of about 1.2 babies per woman. So they were facing this very problem you're talking about, this inverted age pyramid. Very few young people to support a lot of older people. And what they were trying to do was to come up with a way to solve this problem. So these young economists decided they were going to try to raise the fertility rate, right? They were going to try to get women to produce more babies. And I said, look, this is not going to work. You guys have not been around long enough to realize we battled to get birth rates down. We succeeded. We are not going back to these very high fertility rates. I said, you only have two options. One is to increase migration, which they weren't interested in doing. And the other is to encourage people to remain in the labor force for a longer time period so that older workers in Italy can contribute what you need in the way of a labor force. And in my view, that's going to be the only option available to countries with these inverted age pyramids.
Now, there's a gentleman back there.
I am in higher education, and I am dedicating my energy to training the next workforce and working with older adults in mental health. What is it that we need to do to attract new workers and new people who go into healthcare professions working with older adults, and especially in the media, turning over this whole anti-aging bias, stereotypical kind of I want to tell the story that I want to hear rather than the one I know. And so what do we need to do, and what suggestions do you have about changing those stereotypes and looking forward to and attracting workers and the whole idea of aging?
Last year I chaired an Institute of Medicine of the National Academy of Sciences study called Retooling the Workforce for the Future Elderly Population. You might take a look at that. It's got chapters on mental health, workforce, and what might be done. There are a number of recommendations about, covering debt forgiveness and scholarships and things like that. But let me just give you one sentence answer. I think we need to pay these people more. And I think that will enhance the dignity associated with the tremendous, they're all going to heaven, these people, okay? And they're underpaid, and because they're undervalued by our society. And if we pay them more, I think it's going to help recruit people into the workforce.
Time for just maybe one or two more questions. How about over here?
I was curious in visualizing the future with the aging population, especially the disabled population. Have you seen any really interesting urban planning to plan for this? Because I was thinking of New York as being sort of the haven for older people. It's supposed to be a good place to live because of the neighborhoods. You can get everything you need by walking. But when I look at the sidewalks and I think of how crowded they are already and picturing walkers and next to strollers, just a few of them, next to wheelchairs, have you seen any really interesting innovations, or are there any model cities?
Yeah, I would say three things. Number one, the World Health Organization has a Healthy Aging Cities initiative, and in the United States, the city of New York is the major city that's participating in that. There's a fair amount going on. The mayor of New York is a proponent of this. Secondly, the Brookings Institution, full of elite scholars with respect to this area, is doing some work in this area. Thirdly, the MacArthur Foundation has helped us attract Henry Cisneros, former Secretary of HUD, to work with our network on an initiative about housing and community design in the future, which we've just started a couple weeks ago with our first meeting. So we hope to be able to come out with a volume related to this in the next year or so. And it was a good example of how the foundation's staff and contacts and ideas have been helpful to us. But I don't have any cities that I could send you to, although I'm told Cincinnati is a good example.
Well, and I know New York City is a clear example. I know Linda Fried, one of the members of our network, has been instrumental in helping New York become an age-friendly city. But it's a really good question. I can't really think of any model cities that exist anywhere in the world that have essentially created the vision that we have in mind for an age-friendly city yet. New York is probably further along than most.
I'm the timekeeper. I think our time is up. Thank you very much,
Thank
Jack
you.
and Jay, and thank you.